Hi there, Medical Wildcats. I'm Joseph Guggenheim. I'm a 1972 alum of the medical school. And this month's presentation is on Dr. James McCune Smith. February is Black History Month. So this month I will be talking about Dr. Smith, who was a physician, abolitionist, scientist, and pharmacist. This is the only known picture of him. He was a medical pioneer. He was the first Black person in the United States to earn a medical degree from a medical university. He was the first Black person to own a pharmacy in the U.S. He was the first Black person to have articles published in a U.S. medical journal. And he was thought to be the first Black medical doctor to publish an article in any scientific journal, which he did in 1837, the year he graduated from medical school. He has been called the foremost Black intellectual of the 19th century. He was fluent in many languages, Greek, French, and Latin, and also had a working knowledge of Hebrew, Italian, German, and Spanish. We don't know exactly how many articles he published because some of them have probably been lost, but we know he authored over 100 articles in ethnology, geography, and medicine. He was active in the abolitionist movement, and he pioneered early research on the relationship between health outcomes and social disadvantage. Smith was born into slavery in 1813 in New York to a mother who was a former slave and a father who was a white merchant. We don't know much about the father. There is a record of him on the records when Smith enrolled in the medical school in Glasgow, but that is about the only thing we know about him. Smith was emancipated at age 14. He grew up in the 5 Points neighborhood of Manhattan, which was one of the poorest and most densely populated areas in the city. It was a place where enslaved people were openly hunted in the streets and alleys. He attended the African Free School, as shown on the right. This was established by Alexander Hamilton and other white people in what was called the Manumission Society. This was designed to create a Black intelligentsia. Smith was described as an exceptionally bright student. He was tutored by Reverend Peter Williams, who was the second African-American priest in the Episcopal Church. Smith was denied admission to U.S. medical schools and colleges, including Columbia and Geneva Medical College in New York City, because of his race. Reverend Williams encouraged Smith to apply to the University of Glasgow in Scotland. He attended the University of Glasgow, where he quickly was awarded a bachelor's degree in 1835, master's degree in 1836, and a medical doctor degree with honors in 1837. The medical school in Glasgow was considered one of the best in Europe in both clinical experience and research. Smith did his postgraduate studies in France and also studied gynecology at Glasgow's Lock Hospital. He returned to the United States and established 2 pharmacies in Manhattan. He practiced for more than 20 years at the Colored Orphan Asylum in New York City, as shown on the right. He was paid $100 a year for his services, but he was denied transportation on the public transportation and had to walk 6 to 7 miles a day round trip to and from work. He was later granted the privilege of riding on the public transportation. The orphanage was burned down by a mob in 1863, and more than 100 Black people were killed. Smith feared for his family's safety, so he moved them to Brooklyn, also for his children's education. The 1870 census classified his 5 children as white. Smith said that the battle against caste and slavery is our battle, and he was an effective warrior. He was recognized as an effective abolitionist long before he was recognized for his contributions to medicine. He made his first abolitionist speech at age 11, and the manuscript is on file in the New York Public Library. He began his abolitionist career as a young student in Glasgow. In the United States, he opposed the immigration of free Black people in what was called the Liberian colonization movement. This was a movement to ship Black people from the United States back to Africa to a colony in Liberia. He aided the refugees in the Underground Railroad, and he opposed the Supreme Court decision in the Dred Scott case. He joined up with James Pennington and helped organize the Legal Rights Society in Manhattan, which was a forerunner of the NAACP. He edited a couple of periodicals, the Colored American and the Anglo-African magazine. These were venues for Black people to express their opinions to a wide readership. He teamed up with Frederick Douglass. He wrote the introduction to Douglass's My Bondage and My Freedom. They both emphasized the importance of education for Black people. With Douglass, he established the National Council of Colored People, the first permanent organization for Black people. He wrote a column for Douglass's paper under the pseudonym Communipaw. And Douglass said that Smith was the single most important influence on his life. Smith was long recognized for his abolitionist politics, but his medical writings are just now being recognized. He used his training in the emerging sciences of statistics and public health to refute racism. We don't know how many papers he published because scientific papers and publications by Black doctors were not preserved like those of white doctors. In 1840, he published a case report. This was thought to be the first case report by a Black physician on excessive salivation. This was read before the New York Medical and Surgical Society by Dr. John Watson. Smith was asked not to deliver the paper and was asked to withdraw his application for membership to the organization in order to avoid interfering with the harmony of the young institution. Smith's article, which was published in the London Medical Gazette in 1837, was the first known article published by a Black medical doctor, and he published 2 of them in this paper. While he was a resident in gynecology at Glasgow's Lock Hospital, he exposed the practice of a senior physician, Alexander Hannay, who was treating gonorrhea in impoverished women with solid silver nitrate. Hannay's patients complained of terrible pain with the treatment, and one baby even died when the mother was treated. He witnessed the pain and suffering and attributed it to exploitation due to poverty and inequality. He thought that Hannay was trying to promote his own reputation by trying to be an innovator, and the article is seen on the right. In 1844, he published a study in the New York Journal of Medicine, which was the first publication by a Black physician in a U.S. medical journal. It was a report of 5 women who had experienced amenorrhea coincident with the use of opium. Discontinuation of the opium led to return of the regular menses. In 1844, Smith refuted a statement by Orville Dewey that asserted that Black people in the post-emancipation free states were not being so well clothed, fed, or as happy as the enslaved people in the South. Smith rebutted this by constructing statistical tables that show that Northern Black people were living longer, achieving scholastically, attending church more, while suffering less frequently from insanity in comparison with their Southern enslaved counterparts. U.S. Vice President and Secretary of State James Calhoun was a staunch supporter of slavery, and he derogated the idea of freedom for Black people, citing the high insanity rate and mortality rates among free Black people. In 1846, Smith responded with statistical research, which showed the fallacious use of the higher mortality rates in the North to justify slavery. He did this in several publications. In 1846, he rebutted Calhoun's work in The Influence of Climate on Longevity. In 1843, he had a paper and a series of lectures, The Comparative Anatomy and Physiology of the Races, to refute phrenology, which was the study of the shape and size of the brain and skull, which said that the Black brain was smaller than the white brain. Smith said that the proportion of mortality is a statement of how many persons die in a population. This, of course, does not state the age at which those persons died. Greater mortality might actually accompany greater longevity. This seems obvious to us now, but that was innovative at the time. Smith's work was presented at the prestigious Boylston Society at Harvard. His work showed that the 1840 census was racially biased, but the government never bothered to correct the 1840 census. Smith published a paper titled lay puffery of homeopathy. We don't use the term puffery much anymore in medical literature, but it means an exaggerated claim of quality. Smith uses statistical analysis to refute a paper by William Lothrop, which stated that the homeopathic treatment of children in New York City orphanages led to lower death rates than those treated with orthodox medicine. Smith refuted Thomas Jefferson's theories of race, which Jefferson expressed in Notes on the State of Virginia. Jefferson had written that he believed Black people were a distinct race that was inferior to white people in both body and mind. Smith published in 1859 that race was not biologic, but was a social category. Despite Smith's trailblazing work on social justice for Black people, his descendants often viewed themselves as white. He had 5 children, which were classified as white in the 1870 census. Smith's great-great-great-granddaughter, Greta Blau, made the connection between Smith and her family when she took a Black history course at Hunter College in New York. She found Smith's name inscribed in her grandmother's family Bible and realized she was a descendant. Smith's living descendants placed a new gravestone on his unmarked Brooklyn grave in 2010. And you can see Ms. Blau here in the background. Ms. Blau stated that her family's willful amnesia mirrored on a very small scale a nation that forgot parts of its past in order to define itself as white. Well, let's get together again virtually next month. In the meantime, stay safe, stay healthy, and stay connected. And I look forward to our meeting again next month.